Hello everyone, my name is Yanmei Tie. I'm an assistant professor of neurosurgery at Brigham and Women's Hospital and Harvard Medical School. The title of my talk is Neurosurgical Applications of Movie-fMRI. I have no disclosures. First, I will talk about application of Movie-fMRI for pre-surgical language mapping. Conventionally, we apply task-based fMRI to map motor or language areas in neurosurgical patients when their tumor is located within or close to these regions. However, the precisely timed tasks can be highly demanding for the patients to understand and perform. Especially for language mapping, usually the patients are often the very ones struggling to perform these tasks due to language or other cognitive deficits. In our hospital, the task-based language fMRI is infeasible or failed in about 1/3 of the patients. So clearly there is a need to develop task-free, or we can call it easy-to-perform, paradigms for those patients so they can benefit from non-invasive fMRI language mapping. The idea of using movie or naturalistic fMRI for language mapping originated from the studies showing that when a group of healthy subjects watch the same movie clip, especially with the scenes containing more emotionally arousing narratives or social interactions, their brain activity may be synchronized in the sensory and higher order cortical areas. So this is an early paper by Hassan that shows that the responses in the auditory cortex of each subject were similar during repeated watching of the same clip, and also they are highly correlated across different subjects. We can see from the inter-subject correlation map that many brain areas showed highly synchronized responses, including auditory, visual, and attentional areas. So our question is that can we adopt this method or leverage the phenomenon to map individual patients' language areas? To test this idea, we compared the inter-subject correlation maps of two different clips with language content in 15 healthy subjects. One is the 7-minute clip from The Parent Trap, which contains scenes with emotional spoken dialogue and an involving narrative interleaved with scenes of just background music. And another is a scientific documentary film with voiceover, The Living Sea. The inter-subject correlation analysis maps indicated that the family film Parent Trap induced synchronized responses in extensive brain areas encompassing visual, auditory, temporal-parietal language, and frontal-limbic emotional networks, consistent with other work showing that movies with emotionally evocative narratives and social interactions elicit high inter-subject neural synchrony, while The Living Sea induces synchronized activities mostly in the visual and auditory areas. So we continued our feasibility study in more healthy subjects watching The Parent Trap 7-minute clip to investigate its effectiveness in mapping language areas with the hypothesis that movie with emotionally arousing narratives and social interactions can better engage the neural networks that support language function in real life, including the preserved functional areas in patients with language deficits. To analyze the data from 22 healthy subjects, we first used a hypothesis-driven approach by developing a language response model and used the model in a GRM analysis. We defined 6 language response regions based on individual subjects' functionally defined language ROIs. Then the time course responses from these regions were extracted, and a language response model was derived based on a leave one out cross-validation approach. Using the model in a GRM analysis, individuals' language maps were derived, and here is the group-level GRM results. The red is the result of the Movie-fMRI, and the blue is from a task-based antonym generation fMRI. For the temporal cortex activations, in addition to the putative Wernicke's area, bilateral activations were reviewed in the middle temporal gyrus that extended dorsal anteriorly to the superior temporal gyrus from the Movie-fMRI. This bilateral activation pattern in the temporal cortex is consistent with the framework that has been proposed for speech comprehension. In contrast, the task-based antonym generation fMRI revealed extensive activations that spread all over the left IFG, with only small activations in the left, middle, and inferior temporal gyri. Following the feasibility study in healthy subjects, we collected Movie-fMRI data in brain tumor patients using the same 7-minute movie clip and compared with task and resting state fMRI. This is the workflow of this patient cohort study. Here, we used a data-driven approach, the independent component analysis, to identify language-related components from the Movie-fMRI data. 2 language components were identified based on both spatial template and the temporal response model. Here are the results comparing language maps derived from task-based fMRI, the 2 language component maps from Movie-fMRI, and 1 language component map from resting state fMRI. On the right are the maps of inter-subject overlap in activation for these 4 maps, overlaid on the canonical language mask. The left figure shows the comparison of sensitivity and specificity of the 4 maps. Compared with task-based fMRI, the first language component map from Movie-fMRI showed higher sensitivity in bilateral temporal cortex and lower sensitivity in bilateral frontal cortex. The secondary language component map showed higher sensitivity in parietal cortex. The Movie-fMRI primary component showed higher specificity than the task-based fMRI. The Movie-fMRI sensitivity was equivalent to that of the resting state, but the specificity was higher than resting state. The laterality index results showed that there's a significant difference between the Movie and task fMRI in the inferior parietal lobule, and marginal difference in the frontal and temporal ROIs. We also compared the head motion between the paradigms, showing that the head motion is reduced during movie watching compared to task fMRI. And here are 3 examples of individual patients' language maps resulting from different paradigms. Now I would like to talk the application of Movie-fMRI for mapping other critical functional networks. The motivation of this work is that the current pre-surgical mapping focuses on the so-called eloquent cortex, including the sensory motor, language, and visual areas. However, besides those critical brain functions, the behavioral and emotional health is often at risk in neurosurgical patients. This may be due to cognitive and emotional disorders present at diagnosis, and post-operatively, the cognitive and personality disturbances may occur due to treatments such as resection, radiation treatment, or other therapy. So there is an unmet clinical need to expand pre-surgical mapping to include other brain networks that may be critical to patients' emotion or cognitive functions in order to maintain or improve their quality of life. Movies hold enormous potential for revealing the neural substrates and dynamics of emotional reactivity, and movies can elicit emotional responses like those experienced in real life. So we conducted a pilot study to examine the extent to which brain areas associated with emotional activity, reactivity, are functionally synchronized between individuals, and also the activation dynamics in emotion, language, and sensory areas during movie watching. This workflow shows the derivation of emotion and language ROIs based on independent component analysis and inter-subject correlation analysis. So we identified 2 emotional components. Component 1 are in the bilateral amygdala, and component number 2 are in the bilateral anterior insula and the temporal pole. So the functional ROIs were defined using the intersection of the IC map and the component maps. So here are the results. Figure A shows the 5 independent components. There are 2 emotion components and 1 language component, 1 auditory, and also 1 primary visual components. And figure B shows the average time course and standard error across the group in each ROI, and movies screenshots at time points with increased bold response in the emotion ROIs, putatively corresponding to emotional scenes. And the matrix of correlations between time courses in the 5 ROIs, shown in figure D, indicates the strongest correlations between the 2 emotional ROIs, between the auditory and language ROIs, and between the auditory and emotional ROI too, and medium correlations between each of the emotional ROIs and other ROIs, and the weakest correlations between the visual ROI and auditory and language ROIs. So these results demonstrate that distinct functional networks associated with processing of emotional, linguistic, and perceptual aspects of the movie are synchronized to varying degrees during different moments of the clip, consistent with the hypothesis that signals from the different modalities contribute dynamically to emotional salience. So finally, I will draw some conclusions based on our studies and point to future directions. So our studies applying movie or naturalistic fMRI for mapping language function in healthy controls and brain tumor patients showed promising results, demonstrating that the individual's language network can be activated using Movie-fMRI. Our pilot study of using Movie-fMRI for studying other critical brain networks indicated that the emotional salience and language networks are spatiotemporally distinct, supporting the notion that different functional brain networks associated with neural processing of different movie features can be resolved from Movie-fMRI. And there are advantages of Movie-fMRI, such as multiple brain networks can be mapped simultaneously, and compared to resting state, Movie-fMRI limits the degree of mind wandering and constrains the cognitive processes, and we can monitor the patient's engagement in real time, such as by using eye tracking, and we also showed reduced head motion compared to task-based fMRI. Despite the immense promise of naturalistic paradigms for brain mapping, there remain significant obstacles to overcome before they can be widely adopted for research and in the clinical realm. One issue is that few movie libraries include standardized moment-by-moment measurement of various physical or content features as necessary for conducting systematic studies with movie stimuli. And other challenges related to analytical approaches for disentangling the neurophysiological responses to different features of the movie and disentangling aspects of the responses that are shared across individuals versus idiosyncratic. And here, our study, we showed that we can use both hypothesis-driven GRM analysis and data-driven ICA analysis for mapping language areas using Movie-fMRI. Eventually, to support the Movie-fMRI's adoption into neurosurgical management, validation or correlation studies with clinical gold standard electrocortical stimulation brain mapping and neuropsychological outcome in patients is imperative. Finally, I would like to thank the Brigham Image-Guided Neurosurgery Laboratory members and my collaborators, Dr. Anna Liebenthal from McLean Hospital and Jeffrey Gerard from University of Kansas, and the Brigham neurosurgeons, Dr. Kioka and Dr. Linda B. And all the funding resources for this work, and thank you.